When we start a group like this, in this particular group, somebody came up and said, one of the patients said, can we talk about hope? Let's talk about hope. And I'm like, yay, we're gonna talk about hope. And I put it up on the board, and I looked out in the group, and there's this flat expressions looking back at me. We couldn't go to that topic. No one could engage hope. And I threw out a couple of starter things to maybe get the group going, some starter phrases, but nothing. But when I said to them, so what is it like to feel or to live, to feel hopeless? What is it like to feel hopeless? And boom, the conversation opened up. And one by one, people started to tell their stories. And they could relate to one another, that they realize they're not really alone, that other people suffer. And part of that self-reflection for me when I'm in a situation like this, in a group like this, is to look at myself and think, what is my role here? Am I the wise sage on the stage that's up here teaching them about hope? Not at all. I see myself as the guide on the side. I'm there in the room, because as their stories emerge, so does hope. Hope comes out of hopelessness. And I liken it to being a little kid and being outside and it's dark out and I'm running after the fireflies, and one by one I'm reaching up and grabbing one and putting it in a mason jar and then grabbing another one. And that's kind of what I'm doing when I'm leading group, is like, oh, that was really cool. Some profound statement will come out from the depths of their pain. And it's kind of my duty then to lift that up, to lift up the hope, because it's more powerful when it comes from them. And so that is what happens in those groups each week, and I truly can't wait to get there. It's kind of scary in a way sometimes, because we are walking into pain. And as chaplains, we can't stay on the surface, because if we don't engage it, if we don't go there some way with them, they know it, and they think we're not caring. But then again, if we throw ourselves into their pain, that it becomes our pain, well, that's a problem too. So it's kind of that balance between boundaries and having empathy and being there with them. And hopefully, we move from there is nothing left to live for to hope. And you know, we're just one part of that puzzle. I mean, one part of the journey, because all of you that are working in healthcare, we're all part of that journey to hope along with our patients. So these are just a few stories from Jess and my specialized areas in which we minister, but I just want you to keep in mind that all of the people that you met on the previous slides, they are all throughout Agnesian having end-of-life conversations. You know, when I'm in ICU ministry, that's a totally different place. Sister Julia is at the cancer center and hearing stories of people that are faced with cancer and living with it. Kirsten, infant loss. I mean, these ministries and conversations are happening with all of us. And you know, that is just, again, as Jess said before, we really are where life is, in the messiness and the mundane, and hopefully an instrument, a vessel of hope along the way. So thank you for listening. Does anybody have any questions for us?
Are there any questions for our team?
Wow, I don't know what to say, so I'm going to say thank you. Thank you for being who you are and for being here for our patients, our families, for Agnesian HealthCare. What you do is amazing. And those stories, I could hardly keep it together back there. So thank you very much. That was amazing. Transitioning, I guess, to the more mundane, you pass your green slips to the right, and we will draw. What do we have for a prize today? Oh, we have an On-Go roller bag. These are kind of cool, brand new. First one to have one of these. Here are your goodies from campus to campus. So, and please continue to fill out your comment cards if you haven't done that yet. Who would like to draw for us? Well, Jessica, since you haven't sat all the way down yet, you want to draw?
I'll stick my name in there then.
Sure.
No. The lucky Christine Blonigan.
Whoa.
Excellent. Well, just a reminder that we will be back at noon, so if you enjoyed the presentation this morning, please spread the word. Let your friends, your associates know that they can come at noon, bring their lunch, and enjoy a great session. So thanks very much. Have a great day and an even better weekend.